Hello, this is Anne DeGheest from An Inside. This is March the 5th. This is the epidemiology video. A lot of good news in the world. We continue to go down. There's some concerns that Europe may have a bounce back. In South America, in North America, and in particular, the US is plateauing, and Brazil is kicking back up. So we need to keep an eye just to make sure we don't go through that wave that we described in 1918 that went down in February and went back up in March. We'll talk a little bit about Israel and some good data on Pfizer and what's happening in the US. In the second video, we're going to talk about the virus mutation, the latest update. We're going to do a review of post-COVID and some of the new things that the World Health Organization is doing about that, and some new repurposed therapeutic drug that may still to be able to help people on an outpatient basis that have COVID. So I wanted to put some perspective. I try to get new materials at every video there. And just to get a reality checks, we have had pandemics through the history of mankind. And just to give you a reality check, the plague of Justinian, we wiped out 30 to 50 million people, which is a big chunk of the population in those days, which is around 500 ADs. And we had the Black Death, which wiped out between 30 to 50% of Europe during that period there. And of course, the smallpox, we did a good job on South America and the American Indians. So to give you a reality check, if you look at more recent history there, in 1918, we have 50 million people who died, which was around a third of the world population there got exposed to this. And this is where we are. We've had 500,000 people died in the US and 2.5 million people in the world, just because our population worldwide is so much bigger now. So we've had plagues, and it will continue to happen, and we get more plagues. So I think we need to learn our lessons here. And they had consequences. The Antonine plague there, we talked about there, basically went through Rome and is responsible for the end of the Roman Empire on the Roman side. The plague of Justinian there, which was on the Byzantine Empire, which was the bubonic plague there, was also linked to the weakening of that empire. The Black Death, created massive changes in Europe, and that was when we started opening up all the shipping routes all throughout the world with the boats. And then, of course, we know what happened to the smallpox in wiping out 80 to 95% of Native Americans. The cholera that we talked about, and of course, the famous Spanish flu that killed 50 million people and in fact 500 million people at the time there. So be ready, there's going to be more, and we need to learn our lessons there. And the Asian flu is a more recent one in 57, 58. So just want to talk about that to keep the reality checks as we're looking at the numbers on a worldwide basis. We have 150 million cases. And you can see as Europe and the US are going down, worldwide cases are going down. And then we have that upsurge, and that's the one that's getting a lot of experts a little bit worried there. The good news is the mortality, which is 3 to 4 weeks behind, as you can see, has dropped 21%, 3 to 4 weeks after the major drop that we have had on a worldwide basis there. So these are all great news. Most of the cases in the US is from Europe and the US, and I'll talk a bit more about why in a few slides. So just hang in there. Europe, on a normalized basis, so if you look at cases per million people, is having a bit of a bounce back in some countries, but not others. The US has stalled a little bit there in its decrease there, and it's still pretty high up. We're still at a rate in the US that is higher than the summer of last year. And so yes, we have had a massive drop from the peak in January, but we're still at a pretty high rate of 50 to 70,000 cases per day. So what's happening with the mutations? It's a mixed story. Brazil, we're going to talk about, is on the way back up, unfortunately, there. And it has that P1, P2 mutation there that's really nasty. UK and South Africa had this massive peak in January there, but it seems to be able to get some control with some drastic action in staying at home. And the European Union overall, different countries have different outcomes. We'll go into a deeper dive. So Brazil, you can see this is a very worrisome thing. They have that P1, P2 mutation there in my nose, where people, 75% of the people who've had the virus can get reinfected there. So that's a mutation there that's evading what's called the antibodies of people who have had the earlier generation of the virus there. Let's talk about Manaus. This is a picture of the city there. And that variant appeared 8 weeks ago, in a period of 8 weeks, from 0 to 87% of the new cases there. So extremely aggressive there. And this is the worrisome part, is that it is estimated by Imperial College of London there that 25 to 61% of prior survivors are at risk of reinfection there. Right now, there's been a few cases in the US there, but we don't want that mutation to spread around the world there. It is unfortunately 1.4 to 2.2x more transmissible. So even more infectious than the UK version there. We have no data yet on the impact on efficacy. But since it's evading the antibodies of people who had the prior version of the virus, we should expect an impact on the existing vaccine efficacy there. So stay tuned on that one. European is bouncing back up, and you can see Italy is bouncing back up. And look at the proportion where they had that huge mess in the spring of last year, which was 5,000 cases a day. They went as high as 35,000 cases a day, and now they are back close to 20,000 cases a day. So very high load. Francis, put it under some control, and now they're having a problem going behind it. Some good news from Israel. Israel had made a deal with Pfizer where they agreed to pay a premium and get a high availability of doses if they share the data. And amazing data is coming out. And what it shows is that they took a group of 1.2 million participants, put them into two groups of 600,000 patients each, and then they matched them so they had similar age and profile. And what they show, which is the first time we have real world evidence data, is that there's a drop of people who are symptomatic of 92% after the second dose. Remember, the big concern we had is that you could still get infected with the virus. You may not get severely sick, but you could still be infected and therefore transmit it. And so what they've shown is that you have an effect after the first dose of already 79%, which is fantastic. And 92% after the second dose, regardless of age group. There was a worry with some of this vaccine that the efficacy for the older population of the age of 60 was lower. And we've seen that in some of the vaccine data coming up. So this just got published in New England Journal of Medicine, and you can really see the split in the data starting 12 to 14 days. After you get the vaccination there. So these are fantastic world because we want to see real world evidence as opposed to controlled clinical data there. So another thing that came out of Israel that basically show at the Sheba Medical Center in Israel, this got published in the Lancet, is that even if you get one dose of the Pfizer there, you get 85% efficacy. And in that case, it was with hospital staff, so medical staff there. And they were also, this was the first data showing a decrease in the transmissibility. So the ability of somebody who may still have some viral load, what they have measured the viral load is significantly lower. And so that although you may not get sick, you may still carry the virus in your nasal cavity there and pass it to somebody else. And they're able to show is that the viral load is so much lower that the ability of transmitting the disease there is much lower too. And that's vindicating the approach of the UK to say, hey, listen, we're going to delay the second dose and vaccine as many people as possible on the first dose as we can. The other great news is that they showed the Pfizer, which was supposed to be kept in a really low temperature, is working fine at normal freezer temperature. And so the Pfizer has requested a label change, and that will really free up the distribution of the Pfizer vaccine. The global vaccine access is going to be a political hot potato. Europe is having problem. A lot of vaccine shipment that were promised to them have been delayed. As a result of that, today, Italy has decided to block the shipment of 250,000 doses from AstraZeneca that were made in one of their planned them to Australia. Other European countries have made the announcement there that they're going to also keep the production of the vaccine within the EU zone. There is some controversy about the AstraZeneca vaccine that has been approved in Europe, not in the US yet. There was a question about the efficacy being significantly lower for people over the age of 65, which of course is the population of the highest risk. It has been approved in the UK, Belgium, Sweden, and Germany, but France is still questioning the efficacy there. There is a group called COVAX, and the goal of COVAX is to get 1.8 billion doses administered in lower income countries there. And so there, I've started already giving 237 million doses. Sorry, I'm mistyping my dose. Of AstraZeneca to 142 countries, including a lot of the African countries there and South America and Africa. And there is an attempt by the World Health Organization to ask the vaccine company to put all their patents together into a pool to be able to share it. And of course, there's pushback by the World Trade Organization, by these for-profit companies. In addition to that, from a political point of view, you see countries like India who have their own vaccine that they're making, and they've put together what's called a 49 nation friendship program there, where they basically going to produce the vaccine and distribute it in Asia. China is doing the same thing in Africa, and Turkey and Afghanistan, and Russia is having contracts with 50 countries with the Sputnik 5. And these are usually not just vaccine contracts, they're bilateral and trade and all of that. So you're going to see more and more discussion in the coming months in the political power of who has access to the vaccine. On a worldwide basis, it's astonishing how quickly we've been able to get this dose available. So as of today, the US has administered 82 million doses, China 52, the EU, European Union, 37. UK, remember now, is out of the EU, so it's counted separately at around 22 million there, and then India at 18. So these are the kind of the leading country there. But if you look at the percent of the population, you can see that historically, 2 weeks ago when I talked to you last, the US was not really doing that great. And now you can see we're doing roughly 1%. The Israel is doing 1% of the population per day, and the US is doing 0.6% of the population per day. And a way to look at on the percent of the population there who has at least that, who is willing to take the vaccination is an issue culturally. It's, for example, a big issue in France where only a third of the population is willing to get vaccinated. And that is going to create some rebounds in the coming months. And you can see the UK, which has the highest vaccination rate in Europe right now, has 71% of the population who is willing to get vaccinated. So one of the big public policy issues in the world is to encourage and educate the population to feel safe about taking this vaccine. You can see the diversity between 30% to 71% across Europe. So as a result of that, you have a country like Israel that has at least given 1 dose to 56% of their population, which is pretty astonishing. UAE, which is a smaller population, is 35%. UK is 31%. And the US is around 16%. Chile is also doing a great job in doing their own population there. So you can see the diversity of the percent penetration of the populations. So in the US, we unfortunately passed the milestone of 500,000 deaths. And it is such a big number that I was trying to put some other ways to look at this. So if you look at the Arlington Cemetery, pretty much that's the size of the Arlington Cemetery, is 500,000 people there. And it's also another way to look at this is that if you put people in buses, we will have around 10,000 buses that will stretch over 95 miles. With unfortunately all the people we have lost. So it's between New York and Philadelphia, to give you some proportion there. So why are some countries having a high mortality rate than others? A study just came out saying that 90% of the mortality are coming from countries with high obesity rate. And the rate is 10 times higher than countries with lower obesity rate. And the reason is that when you have higher obesity, they did a study, and what they show is that you have 113% higher chance of being hospitalized, 74% higher chance of getting to the ICU, and 48% higher chance of dying. And part of that is that because you have the fat in the abdomen that limit the diaphragm and the lung inflation. And remember, initially the disease has a lung related issue. You also have higher inflammation already from the obesity there. So you have pre-damaged endothelial cells. So therefore you have higher risk of getting blood clots. It turns out fat cells have a high level of ACE2 receptors, and that's the entry point for the virus. So therefore it's a reservoir for the virus to basically enter the body. So the World Obesity Forum just published this study there on 2.5 million deaths in 160 countries, and basically show that the countries that have this 50% of obesity, like the US had, have a 10 times higher mortality rate, which explains what we saw in Italy and Europe and the US. And of course, as you know, 75% of the population in the US is obese or overweight. So that explains some of the issues we've been having. So looking at the US, good news, we have had a massive drop. If you remember 2 weeks ago, 44% in the last 2 weeks. Now this has slowed down to only a 14% drop. And at the peak, we were at 300,000 cases per day. We dropped all the way down to 57 last week, and now we're bouncing back up. So we have to keep an eye that we don't have a plateau or bounce back, because it's still a very high level. It's higher than the summer. So we want to drop down. We need to go below that. We don't want to be complacent. This is not the time to reopen the economy and having people remove their mask. So just please spread the word. The cases have dropped 5% this week. Hospitalization, remember, has a 3 to 4 weeks delay, has dropped by 16%. We're not doing enough tests. We have dropped 25% in the number of weekly tests from the peak. We need to do more testing. We need to start going from diagnostic to surveillance so we can identify people who are still asymptomatic and infecting the population and spreading the disease. And in the second video, we'll talk about some of this mutation there and where they are in the US. So on an overview, there is the good news is that, overall, most of the states are falling, but we still have some cases rising in Vermont, New Jersey, Colorado, all those countries there in this kind of color there, are going back up. And so Colorado is up 15%, Arizona 53%. So we need to keep an eye. We don't have that famous fourth bounce that historically happened in 1918. We don't want it in March. Cases per 100,000 people in the last 7 days, you can see how much of a drop, and you don't want the darker colors, but you can see this difference like in Texas and Florida, which unfortunately are reopening probably too early there. They're going to get a bounce back, as opposed to places like California. And you can see the raise on a normalized basis there. Is a big difference from state to state. Just to give you an idea where we were in early January in the number of cases per million. And you can see, Texas, you compare week per week in cases per million there. Texas was really hot rod, as well as Florida there, and we have dropped drastically there. It's still a high number there. So although it's a massive drop there, it's still a contagious number. So on a regional basis, you can see the South and the Northeast are still very high level. And so we really want to make sure we have another 1 month or two to bring it back down to a lower level. Good news overall, in the US, the positivity rate has dropped drastically, but look at Texas and Oklahoma. So, and these are unfortunately the states that are reopening there. So there's a very high probability, it's my crystal ball, that we're going to get bounced back in those states. And again, the good news, look where we were a month ago. That was pure red. And now most of the country, except Texas and Oklahoma, have got control in the positivity rate. So that in hospitalization, remember, I have a 3 to 4 weeks lag. So the good news, they're going down, except for Wisconsin. So I'm not sure what's going on there, but the rest of the country there has major drop, like California has 24% drop. So a couple of websites that I will post. One is called the vaccinefinder.org. It allows you to find the vaccine availability where you live in your zip code. And that could be from pharmacies, from clinics, from health department. Every state is changing the way they're trying to open up the allocation, the availability there. So initially the website has 29,000 locations. So if you haven't had your chance to be vaccinated, take a look at that. And the Global Health Initiative is starting to track 5 million cases, and it's being built by Google and Rockefeller because we need longitudinal data and on this disease there. So on the US vaccination, we have hit close to 110 million vaccine, which is astonishing in the last really, 7 weeks there. Around 16% of the population has at least received 1 dose, and 8% now have received 2 doses. And then remember, we have to look at people over the age of 18 years old because we cannot vaccinate the younger population. So we have around 10% of people over the age of 18 who have been vaccinated. 21% have at least got 1 dose. So we should see an effect in decreasing the infection rate, pretty much split between Moderna and Pfizer. And the great news is that the mortality rate in long-term care has dropped like a rock because we have vaccinated most of the people in long-term care, both the residents and the caregiver. So the US vaccination rate, look at the increase there. January 20th is over here somewhere when you had the change of administration there. It's astonishing. We're now doing 2 million cases on the average, 2 million doses per day, and it's expected to continue to increase as we're opening up CVS and additional sites. You can see the impact of the vaccination of long-term care, how the mortality in long-term care has dropped like a rock. So it does work, get vaccinated. It is very effective at stopping the mortality rate. The state vaccination rate is all over the places, state by state. This is California here. You can see the percent of the population that has received at least one dose versus 2 doses. And the dark color is the 2 dose, the 1 dose is there. And so you can see some states are doing, like Arkansas is doing very well, and other states, are not doing as well, I think this is Georgia. So take a look there, for your state. So state vaccination eligibility is all over the places, and it's changing literally on a weekly basis there. But most states right now are still vaccinating people over the age of 65 or people who are younger with pre-existing conditions. So California has officially launched 2 days ago a new system there that's managed by Blue Shield of California. Please go to myturn.ca.gov. It's a centralized booking system to replace the hodgepodge of county by county system that were not really working, and a lot of these systems were crashing all the time. So, please go to Blue Shield, myturn.california.gov to basically register. They expect the full transition by mid-March with around 4 million shots per week, so drastically increasing the capacity of what we can do in California there. Right now, the eligibility in California is still people over the age of 65 or people with severe health ailments there, and it's listed on the website. These are pretty high bar as far as the pre-existing conditions. The California dashboard is kind of flat. You can see that we were dropping and then we stopped dropping. In fact, if anything, there's a tiny bit of a bounce upwards. We have 10 million doses have been vaccinated there, but we still have cases. And we still have mortality there. So we still, San Diego and Los Angeles is where the hotspot is. California vaccination by race is not, of course, equal. The white population, 32% of the population has received a vaccination as compared to the Black and the Latino population. And so today, the government of California has announced they're going to reserve 40% of their vaccines for the lower income and essential workers, just to make sure that we can make sure the economy is protected as we're reopening up. Good news on the hospitalization in California. I should have did the slide. This is as of today. So this is not 214, it's 3.5. But you can see that the mortality rate as we are vaccinating the elderly there, you can see that red bar, which is the elderly population, has dropped drastically. So the vaccine is effective at stopping the mortality rate. And then I'm trying to get some upbeat news or downbeat news. There's a baby bust going on, and there's a baby bust everywhere. There is a massive drop in fertility that people are observing in 2020. And the majority of that is people deciding to postpone getting pregnant there. And that includes some of the biggest countries like Germany, France, Italy, Spain, and the UK. Italy, for example, has dropped 22%. And one of the problems for Italy is not the mortality rate, just because part of that is the COVID that's still very active there, is now significantly higher than their birth rate. And of course, that's something that all countries have to deal with. At the US, it's estimated that this year we'll have 300,000 fewer babies. On the average, we do 4 million births. So that's a close to 10% lower number of pregnancy. Good news, U.S. economy is recovering. You may have heard the news that came out that we have added today 379,000 jobs in February. And as a result of that, the stock market loved it. They went straight up. Unemployment rate, is around 6.2%. We hit as high as 15%. But it depends on the sector. The leisure and hospitality industry, is still hitting really hard. There's one announcement after another, people fighting for bankruptcy in that sector there. So what's coming back is retailing. And general manufacturing there is coming back up. So please stay positive, wear a mask. We're not out of the woods yet. Please hang in there. We've done pretty much 1 year now. We need another 2 months to really get lick this thing and get most of the population vaccinated. And please encourage people to get vaccinated. And take a look at my second video on clinical. There's a lot of good insight, a lot of new information on post-COVID, which is the real risk of being infected, is a 10 to 30% chance of getting permanent damage. So we'll talk more about that and some update on the mutations.